Hello, my name is Jessica Hernandez, and today I'm going to be going over how to assess 5 different flexibility protocols. For all assessments, you should ensure that your client is not wearing shoes. We are starting with the Thomas test, which will be assessing the hip flexor muscles. To starting the test, you should have ensured that your client has warmed up at a moderate intensity for 5 minutes. When conducting this test, your client should be in a supine position and have your client lift their leg back to where their lumbar spine is now touching the floor. If the opposite leg rises, their hip flexors are inflexible, as opposed to the legs staying in contact with the floor, meaning that they are flexible. Be sure to assess this test twice and gather your client's score, being flexible or inflexible. Next, we have the straight leg raise test, which is intended to test the flexibility of the hip extensor muscles. For this test, you will need a goniometer to measure the joint angle. You should have your client warm up at a moderate intensity for 5 minutes. Have your client lay on their back in a supine position. Raise one leg while leaving the other leg flat on the floor. Place the goniometer at the axis of the greater trochanter and measure the angle. Your client repeat this process for both legs. If your client measures at a 90-degree angle, this is known as ideal. If they are at an 80-degree angle, this is acceptable, and if they are 80 degrees or less, this is counted as unacceptable. For example, my client was right at a 90-degree angle, meaning he was ideal. We now have the chair sit and reach test. This assesses the hamstring flexibility in individuals ages 60 or older, only testing one leg at a time, which reduces stress of the spine and lower back. Some equipment that will be needed will be a chair with a height of 17 inches and a roller. Be sure that the chair is against a wall so that it does not tip forward. The client should warm up for 5 minutes. Since this test is intended for older adults, make sure that there is no fast or jerky movements. Prior to testing, allow your client to have a practice trial, and then 2 test trials on each leg. Have your client sit on the front edge of the chair and extend the leg that you are testing. Keep the heel on the floor and the ankle dorsiflexed. The opposite leg should be flat on the floor at a 90-degree angle. Have your client reach for their toe with one hand right on top of the other or parallel to one another. Keeping the leg as straight as possible, their spine and head should be in normal alignment with their back, and they should exhale while they are reaching towards their toe. Have your client hold for 2 seconds. With the ruler parallel to the lower leg, you will measure the distance in inches between the toes and fingers. Be sure to repeat the procedure twice on both legs. If your client is unable to reach their toe, this will be scored as negative. If they are right at the toe, it will be scored as 0, and passing the toe will be scored as positive. We are now going to conduct the YMCA sit and reach test, also known as the V sit and reach test. This test is intended to test hamstring flexibility. First, you should ensure that your client has warmed up at a moderate intensity for 5 minutes. Some equipment that will be needed is going to be a yardstick, which will be placed on the floor, and a 12-inch tape, which will be at a right angle at the 15-inch mark. As shown here, your client should sit with the yardstick between their legs, legs extended, feet 10 to 12 inches apart, heels touching the edge of the tape. Make sure that your client's hands are either parallel or overlapping without one leading the other. While your client is reaching forward, ensure that your client's head is tucked in between their arms while they are exhaling. You should ensure that your client is going down in a smooth motion and not bouncing. Make sure that he is touching the stick the whole time, reaching as far as possible, and holding for 2 seconds. Have your client attempt 2 trials and record the best of the 2 scores in inches. Based on your client's score, you will use the chart which shows the fitness categories for the YMCA sit and reach test by age and sex. My client is a 24-year-old male who scored at 18 and 17 inches, meaning he is average. Lastly, we have the Canadian Trunk Forward Flexion Test, also known as the Standard Sit and Reach Test. During this test, you are assessing the hamstring flexibility, and all you will need is a flexometer. Before starting the test, you should want your client to warm up for 5 minutes at a moderate intensity. Have your client sit with the soles of their feet flat against a flexion meter with their legs extended but not pressed down. They should not have shoes on. First, you should instruct your client to reach forward with both hands as far as they can. Make sure that they are parallel or one on top of the other. One hand should not be leading the other. Your client should inhale at the start position and exhale as they push forward, allowing their head to drop between their arms, and hold the position for 2 seconds. The test will be conducted twice, and the score is determined by the farthest point reached with the fingertips. You will get the best score from both attempts in centimeters. Once you have their score, you will use this chart to classify your client's flexibility. This chart will show you the fitness categories for the trunk forward flexion using a sit and reach box by age and sex. My client's scores were 25 centimeters for both trials. The box that was used was marked at 23 centimeters at the 0 point. Some boxes are marked at 26 centimeters. Based on the table, these values are set for a 26 centimeter box, meaning that we have to subtract 3 centimeters from the values in the table to ensure the proper category. Being that my client was at 23 centimeters, I will subtract 3 centimeters from all these values in the categories, leaving my client at fair.